Before we do anything else today, let's do a very simple testosterone therapy reality check. In the next 30 seconds, you're going to get a quick snapshot of whether you may be looking at testosterone therapy with clarity, confusion, or expectations that are setting you up for disappointment. No medical jargon, no lab printouts, no guessing, just honest answers. If you are over 65 and you've been wondering whether testosterone therapy is safe, risky, or potentially life-changing, this matters more than most men realize, because this is one of those topics where men often hear two extreme messages. One side acts like testosterone is a fountain of youth. The other side talks like it is automatically dangerous. And real life is usually more nuanced than both. I'm Dr. James Whitaker, and here is how this works. You are starting with a perfect score of 5 points. I'm going to give you 5 very common beliefs about testosterone therapy. For each one that sounds true to you, subtract 1 point. At the end, you'll know whether you're looking at this topic with balance or with assumptions that may need correcting. And stay with me until the end, because the number one truth older men need to hear about testosterone therapy is not whether it works. It is who it is actually meant for. Let's begin. You start with 5 points. Number 1. Do you believe testosterone therapy is basically an anti-aging shortcut for any man who feels older, slower, or less energetic? If yes, subtract 1 point. Number 2. Do you assume testosterone therapy will automatically fix energy, mood, libido, strength, and body composition all at once? If yes, subtract 1 point. Number 3. Do you think one low testosterone result is enough to prove you need treatment? If yes, subtract 1 point. Number 4. Do you believe testosterone therapy is always dangerous for older men no matter the situation? If yes, subtract 1 point. Number 5. Have you ever ignored the fact that sleep apnea, obesity, medicines, and other health problems can lower testosterone or mimic the same symptoms? If yes, subtract your final point. Now look at your number. If you scored 5, that's a strong starting point. You may already have a more balanced understanding of what testosterone therapy can and cannot do. If you scored 3 or 4, you're where many men are, interested, aware, but still carrying a few powerful misconceptions. If you scored 2 or lower, don't feel bad. This topic is filled with hype, fear, half-truths, and marketing language. That is exactly why we are doing this today. Go ahead and write your score in the comments. I'd also like to know your age, where you're watching from, and what your biggest concern is when you think about testosterone therapy. Is it low energy, lower sex drive, loss of muscle, mood, or side effects? Save your score, because we are coming back to it. Now let me give you 1 minute of simple science. Testosterone plays an important role in bone density, fat distribution, muscle strength and mass, red blood cell production, sex drive, and sexual function. Testosterone levels do gradually decline with age, often around 1% per year after early adulthood. But that does not mean every older man with age-related symptoms automatically needs testosterone therapy. Mayo Clinic is very clear that testosterone therapy can help men with true hypogonadism, but the benefits for otherwise healthy older men with age-related decline are much less certain. That is the key distinction. Low testosterone symptoms and low testosterone treatment are not supposed to be based on feelings alone. The Endocrine Society explains that diagnosis requires both symptoms and consistently low early morning testosterone levels on more than one test. They also note that obesity, sleep disorders, type 2 diabetes, medications, and other health issues can contribute to low testosterone or to symptoms that look very similar. So now let's count down the 3 biggest truths about testosterone therapy after 65. We're going from number 3 to number 1, and number 1 is the one I most want older men to remember. Number 3 is this: testosterone therapy can help the right man, but it is not a fountain of youth. This is where a lot of men get misled. When testosterone therapy is used in men who truly have hypogonadism, it can improve some symptoms. According to Mayo Clinic and the Endocrine Society, testosterone treatment may help sexual symptoms and can support bone health, muscle mass, and anemia in appropriately selected men. But here is the part men need to hear clearly. That does not mean it turns back the clock in every area of life. It does not automatically restore youth, erase aging, rebuild motivation from scratch, or fix every reason a man feels tired, heavier, or less sharp. Mayo Clinic notes there is little evidence that testosterone therapy improves vitality and energy in otherwise healthy older men to the degree many expect. Because realistic expectations protect men from 2 things: false hope and false disappointment. The most common mistake is treating testosterone like a universal answer to aging. If you need an easier version of this truth, remember this: testosterone therapy can be useful medicine, but it is not magic. Number 2 is this: risks matter. but so does proper selection. This is where fear and nuance need to meet. Testosterone therapy is not risk-free. Mayo Clinic lists possible concerns such as worsening sleep apnea, acne or skin reactions, enlarged breasts, higher red blood cell counts that can raise clot risk, and stimulation of benign prostate growth or existing prostate cancer. The Endocrine Society also highlights that testosterone should not be used casually in men with suspected or known prostate or breast cancer, untreated sleep apnea, high red blood cell counts, recent heart attack or stroke, blood clots, or men actively planning fertility. Endocrine Society. Now here is the balancing truth. Risk is not the same thing as automatic danger in every man. The real question is whether the man has the right diagnosis, the right symptoms, the right monitoring, and the right medical situation. What should you notice if you think about it this way? You stop asking only, is it safe? And start asking, is it appropriate for me and under what conditions? Why does this help? Because almost every meaningful treatment in medicine involves both benefit and risk. Smart medicine is not about pretending risk does not exist. It is about matching the treatment to the right patient and monitoring it well. The most common mistake is swinging to an extreme. Either everyone should be on it or no older man should ever touch it. Both are lazy conclusions. If you need an easier version of this principle, think of it this way. Testosterone therapy is neither harmless for everyone nor harmful for everyone. It depends on the man, the diagnosis, and the follow-up. And before we move to number 1, if this video is helping you think about testosterone therapy more clearly, take a moment to like the video and subscribe to American Urologist. It helps me reach more older men who are trying to sort through hype, marketing, and real medical questions. And if you've made it this far, let me know in the comments whether your biggest concern is benefits, side effects, or simply knowing whether you'd even be a candidate. Now let's get to number 1. Number 1 is this. The biggest truth about testosterone therapy after 65 is that it should be used for diagnosed hypogonadism, not as a shortcut for normal aging. This is the core issue. The Endocrine Society states that testosterone therapy is recommended for men with hypogonadism, not simply for boosting testosterone to improve strength, appearance, athletic performance, or to treat aging itself. They specifically note that diagnosis should require symptoms plus consistently low testosterone levels on at least 2 early morning blood tests. Mayo Clinic also says treating normal aging with testosterone therapy is not advisable and encourages addressing reversible causes like weight and muscle loss through lifestyle strategies when appropriate. Here is why this matters so much. A man may feel tired, heavier, less motivated, more irritable, and sexually diminished for many reasons. If you jump straight to testosterone without understanding the full picture, you may miss the real driver of the problem. What should you notice if you really understand this? Relief, actually, because it takes the pressure off one hormone to explain every change in your life. Why does this help? Because it pushes you toward real diagnosis instead of wishful treatment. The most common mistake is starting with the treatment question before the diagnosis question is answered. If you need an easier version of this truth, remember this sentence. Testosterone therapy is for documented deficiency with symptoms, not just for feeling older. Now let me give you 3 daily boosters that can help older men think more intelligently about testosterone health before they rush toward treatment. First, protect your sleep. Untreated sleep apnea and poor sleep can lower how men feel and may contribute to low testosterone patterns. If your sleep is broken, your snoring is severe, or you wake tired every day, that part of the picture matters. Second, pay attention to waistline and muscle loss. Obesity and inactivity are closely tied to testosterone problems and to symptoms that mimic them. Sometimes the first smart step is not a prescription. It is reversing the conditions that are dragging your system down. Third, stop thinking in single symptom terms. Energy, libido, erections, mood, sleep, strength, and body composition often need to be looked at together. A cluster tells a better story than one complaint. Now let's close the loop. Think back to your opening score. If you scored low today, that does not mean testosterone therapy is wrong for you. It means there may be gaps in how you're understanding the question. Recheck yourself in a few days and ask, do I now understand that testosterone therapy may help the right man, may carry real risks, and should be based on diagnosis rather than hype? If the answer is yes, then today's video did exactly what it was supposed to do. Today, we talked about the truth about testosterone therapy after 65. We clarified that it can help some men with true hypogonadism, that it is not a magic anti-aging solution, that risks and monitoring matter, and that the biggest question is not, do I want testosterone, but do I truly have the kind of deficiency this treatment is meant to address? We also covered 3 daily patterns that often deserve attention before older men reduce the whole conversation to one hormone. This is not about fear, and it is not about hype. It is about matching the right treatment to the right man for the right reason. If this video helped you, share it with another man over 65 who has been hearing mixed messages about testosterone therapy and wants the topic explained clearly. And if you want to keep going, watch the next video on your screen, where I'll show you the foods and habits after 60 that can quietly crush testosterone without most men realizing it. I'm Dr. James Whitaker. Stay informed, stay steady, and I'll see you in the next one.